this opportunity to talk a little bit about suicide prevention and some opportunities for legislative advocacy. This is a topic that I'm very passionate about, really excited about, enjoy this work a lot, and so excited to talk with all of you about what I think is a really exciting session for suicide prevention here in Kansas. So I think I'm going to do the thing where I ask if folks wouldn't mind kind of introducing themselves in the Zoom chat, so I can get to know kind of who's here and kind of who you're joining with, or if you're just here on your own because you're so excited about advocacy and policy work like I am. Like, are you a big policy nerd? Let's hear that for sure. Hey, Heather. Marion County Substance Abuse Prevention Coalition, excellent. Got some DECA folks here. That's always very exciting. So while we're doing that, I will introduce myself to those of you who don't know me. My name is Monica Kurz, and I am with the Kansas Suicide Prevention Headquarters, or KSPHQ. We are a nonprofit based out of Lawrence, Kansas, but serving the entire state of Kansas for suicide prevention activities. We do a couple of different things. We are a National Suicide Prevention Lifeline provider. So we provide NSPL services in all 105 counties in Kansas, and we're the only folks that do that in 103 of those counties. In addition to our National Suicide Prevention Hotline program, we also are KPC partners and work with all of our partners in the Kansas Prevention Collaborative to provide, some subject matter content on suicide prevention, some education around suicide intervention and prevention best practices, do some work, legislative advocacy work up at the Capitol, just kind of a variety of things that we're really working hard with our partners to keep suicide prevention priorities moving forward in the state of Kansas. So I did put together a bit of a PowerPoint for us today because we've got a couple of things that I want to make sure that you feel like conversant about for the upcoming session. As we're kind of working through this, if you have questions, feel free to throw those in the chat, or maybe throw up your hand and we can unmute and talk about whatever is on your mind. I will tell you that I am by no means an expert when it comes to legislative work, but it is something that I feel really enthusiastic about and have done some learning about over the last 5 or so years. So very happy to kind of talk about all of those pieces today. So Meg, I think we can kind of advance to this objectives slide. So when I thought about what could be hopefully like useful content for folks who are coming to the Kansas Prevention Advocacy Days, what I really thought about is that I think that it's important that you all have kind of like just like a baseline understanding of some of the behavioral health crisis system components in Kansas, because we're going to talk about some big changes that are coming up and some opportunities for educating legislators about why it's important to support those changes. So I want to make sure that we can do an overview of that. Talk about this transition to 988 services in Kansas, and then really think about some actions you can take kind of at that macro level to support suicide prevention activities here in Kansas at the legislative level. So on our next slide, we'll kind of start with just a little bit of an announcement, or not an announcement. If you've heard me talk at anything over the last 18 months, I would say, you have heard me talk about this transition from the National Suicide Prevention Lifeline to a 3-digit suicide prevention and mental health crisis number, or 988. So on July 16th of this year, I used to say July 16th of 2022, like it was so far away, but now it's just July 16th of this year, right? So like just less than 6 months away. All of the telecom providers in the nation have to have enabled that 3-digit dialing code for all of their customers to be able to quickly and easily reach a trained crisis counselor in times of a mental health concern or suicide crisis. Now, in addition to an easier to remember, easier to access number, one of the priorities for this 988 transition is to really think about how we are creating a very robust and comprehensive crisis system for folks in Kansas. So really thinking about making available to the citizens of Kansas, not just a number and a number that I think is going to be really important, but also some response services for folks who can't be stabilized on the phone. So we'll move to the next slide here. But let's talk first about the National Suicide Prevention Lifeline and what that is and what that means. And the reason I want to go through this is because I think that sometimes I take for granted that everyone knows as much as I do about the NSPL. And I think a lot of us are probably pretty guilty of this in our own areas of expertise, right? We live and breathe suicide prevention, substance use prevention, coalition work, whatever that is. And it gets very easy to just make some assumptions that folks know the same things that we do. And I think that this is kind of a common trap when you're talking with legislators, right? That you kind of assume that they have this baseline knowledge that you do and may start throwing around words like Lifeline, and folks may have no idea that those Lifeline calls are answered by a network of over 108 local centers, right? So this is yes, hopefully some education for you all, but also hopefully like me practicing what I preach, right? So kind of giving the necessary information that you need, or to think about how you can explain complex concepts simply to help folks understand the importance of the work that you're doing, particularly policymakers. So like I said, the National Suicide Prevention Lifeline, or 800-273-8255, which is where you would call now to reach this service, is a national number that is answered by a network of over 180 centers. And right now, when a call is placed, the call is routed by area code. So the caller hears an automated message that thanks them for calling the Lifeline, lets them know that their call may be recorded, lets them know that they're going to be routed to a local center, and also invites them to press 1 if they're a veteran and would like to talk with the Veterans Crisis Line, or to press 2 if they're a Spanish speaker and would like to be connected to the Spanish-speaking subnetwork. So after they hear that recording, they're routed to the call center that has said, yep, us, we want to take calls from this area. And so in Kansas, that means if you're calling from an area that does not have a Johnson County or a Sedgwick County exchange code, you come to us. And so we have about 30 seconds to answer that phone call. And if we don't answer it, if we're on another call, if it rings that set number of times, then it goes back into the routing queue, and the network routes it to an out-of-state backup center. Now, if you're calling from Sedgwick County, for example, you'll go to ComCare. And if ComCare is not able to answer, then we serve as backup for ComCare. And so it would be routed to us and then over to the national center. So calls are all answered, but what we do hope is that as many as possible can be answered by local crisis centers in our state. So next slide. So, what do you expect if you do reach a Lifeline call center? I think that there is some messaging out there right now that 988 may be a little bit like 911 for mental health. And it is, in that it's easy to remember, and it's 3 digits and it starts with 9. All of those are definitely things that are the same and similar. But what I think really sets 988 services apart from 911 services is that folks who call 988 can really expect that they will start receiving support or help for their problem or their concern as soon as they get on the phone, right? This is not a case where you're just going to be talking with someone to identify the best person to send to your door. What you're doing when you call 988 is that you're talking with a highly trained crisis phone counselor who is going to be using best practices to help de-escalate those situations, find safety, engage in collaborative safety planning. And then when we get to a place of safety, think about resource navigation and referral. So that really comes with this idea of active engagement and rapport building. We're doing a lot of using a non-judgmental approach and an empathetic tone and demeanor to create alliance with our callers. All of our callers are screened for presence of suicide ideation, and then are given a brief assessment to determine their level of risk. We utilize a nationally recognized evidence-based best practice training for all of our counselors that really sets them up with the skills to engage around a person's suicide, a story about suicide, and then working with any uncertainty that they have to help them to choose safety in that moment. That's where that collaborative safety planning comes in. And then we get to this kind of idea of resource navigation and referral. One thing that I like to point out here is that, a fair number of our callers are contacting us anonymously. I think if you're reflecting on, some people who use a hotline service, sometimes they're using a hotline service because they don't feel comfortable being identified as having suicide risk, right? I think that this is where we really see some of the stigma around suicide and mental health play out, in that folks might find that it's a whole lot less threatening to dial a phone number and talk to somebody than it is to, say, show up in the parking lot of a mental health services provider, right? So we do want to work with folks to make sure that we're not pushing referrals before they're comfortable doing that. We don't want to alienate that person. We want to work at a pace that works for them. That's one of the reasons that we really offer this idea of structured follow-up calls. So most of the callers to the National Suicide Prevention Lifeline are at least offered the opportunity to talk with one of our crisis counselors again in the future. And what that really sounds like is, here are the safety steps that we've talked about tonight. I'm wondering if one additional step we can take is for one of our counselors to call you back in the next 24 or 48 hours and check in on how you're doing. How are you feeling? How are you feeling emotionally? How is that safety plan working? And either following up on any resource referrals we've made or giving resource referrals during that follow-up call. Now, we offer this to a majority of our callers. Not everybody takes us up on it, but again, we have some evidence based on some investigation that researchers have done into the effectiveness of hotlines, that this idea of follow-up contact with someone, even over the phone, is a very powerful way to ensure safety. So that's a large part of what we do. Can advance again. We also, and I think that this is important to say explicitly, speaking of not making assumptions, right, about what people know, you do not need to be in a suicide crisis to call the NSPL or to call 988. We encourage folks with all different kinds of concerns to call us. And we also encourage folks who are worried about somebody else's safety, or who are thinking about how to best support someone who's experiencing a mental health struggle, to call us as well. So in 2021, our center, about 1 in every 20 calls is what we call a third party caller, or this kind of other person who is worried. And what we do there is we train our crisis counselors to really think about how to navigate those calls. Usually they're a little bit faster because folks kind of call wanting some information, wanting some guidance, and so we kind of engage with them, do some instruction on how to have a compassionate conversation with someone that they're worried about, have a conversation about what kinds of resources are available in their area, do some work to figure out kind of what steps may need to be taken for safety. And I think just generally give folks the confidence they need to be a helper to someone in their crisis. So I think it's important to point out that that's a very valid reason to call and a reason that folks do. And I think that that will continue with 988 as well. We can advance to the next slide, Meg. So here we're talking about this idea of structured follow-up and referral. And, I guess I'll point out, we've already talked a bit about this being a best practice and a way that we have some real evidence can reduce the instances of suicide. But I'll just point out again that I think this is an opportunity to kind of check in, review, and revise any safety plans that we've developed with folks. Sometimes you think something's going to work in the moment, and a few moments later, you realize that maybe we need to do some additional brainstorming, think about some additional resources. Or maybe folks have run into roadblocks with accessing services that we've talked with them about, and we want a chance to engage with them and help them navigate those roadblocks. If we were talking with a youth caller, we are always working with our callers who are under the age of 18 to identify an adult in their life that can be a safe adult and help them to achieve that safety, to be less alone with their thoughts of crisis or their thoughts of suicide, and hopefully be the person that helps them to navigate those resources. And so we are always offering follow-up calls to our youth because we do want to see how those conversations went, or offer to have those conversations with that safe adult for them. Okay, thanks, Meg. So that's a little bit of an overview of what folks experience when they call the National Suicide Prevention Lifeline. And then I think that the thing that I'd like to point out here is that it is our NSPL network that will transition to becoming our 988 network. And so, when folks are calling 988, we've talked about the kinds of services that they can expect. But I think that that folks also want to know that they can expect a high level of service because NSPL centers, 988 centers, are held to a high level of clinical and operational standards. It is essential that you have staff who are dedicated to answering the phones, right? This is someone whose job it is to answer the phone. We're not walking around doing other things with a phone in our pocket and hoping that we can finish up the appointment that we're in to answer the phone. So, this is the job that they have. They have specific crisis counselor training. Our folks go through over 100 hours of training before we put them live on the phone. And we have to be accredited to offer our telephone crisis counseling program, right? This isn't just that something that Monica can prop up in her basement, right? And start doing without any kind of oversight. And as I said, we do provide suicide risk assessment to all of our callers. Let's go ahead and So what's going on with 988 in Kansas? So if folks have heard me talk about this before, then you know that one of the things that we have really been prepping for is thinking about the volume increase that we expect to happen, starting in July and then continuing into that first, second, third year of the 988 program. We've got some estimates from the national level that we should expect anywhere between a 2 and 5-fold increase in our current call volume. For those of you who do any program planning, you can imagine how kind of nuts it's driving us, right? To not know in a kind of more informed way about what kind of increase we can expect. But we do know that a couple of things are going to be true, right? The phone number is going to be easier to remember. Can anyone on the call recite for me the 10-digit 800 number, not the people who work for me, but the 10-digit 800 number that I mentioned at the beginning of the call that is the current NSPL number? Anybody rattle that off the top of their head? Okay, can anybody remember the 3-digit number that we're talking about transitioning to? Right, so we do think that it's just going to be more accessible because people are going to remember it, right? That this is not, oh, I almost went down a very deep nerd rabbit hole where I tell you about an episode of the IT Crowd and the parody that they have for the really hard to remember emergency number, but this is going to be easier to remember. So more folks are going to call. We do think that that's true. We also think that as the population is more educated about the services that are offered from 988, that we're going to see people who had been calling 911 when they were experiencing a mental health emergency or a loved one was experiencing a mental health emergency start to self-direct themselves over to 988. And we think that that will lower 911 calls and increase 988 calls. We also expect that some places that are offering just very local numbers may see that some of their call volume is redirected to this easier to remember resource. So, you know, kind of new people who are redirected, we foresee that there will be an increase in the calls. Now, I think that it's important to point out here that folks can still dial that 800 number, that 800-273-8255. Didn't read that off the slide. It's just that ingrained in me at this point, right? That they can still call that and be directed to 988. But as of July 16th, from any phone, you'll be able to just dial that 988 number. In Kansas, the Kansas Department for Aging and Disability Services, or KDADS, is the lead state agency responsible for monitoring and defining the 988 crisis network, or the network contact centers. We expect that calls will continue to be routed by area code for the foreseeable future. Now, this is not necessarily ideal because, for example, I live in the Kansas City metro area. My phone number is a phone number that I've had since I grew up in Leavenworth. I have a 913 area code, but I uprooted my husband and moved him over here to the Kansas side from Missouri, and he still has a Missouri area code on his cell phone. So in my own household at this point, depending on which phone we were to call the NSPL from, we would be connected to different centers. He would be routed to Missouri, I would be routed to Kansas. So it's not necessarily ideal because we do know that people move around with their cell phone numbers. However, this idea of kind of like geolocation or being able to route based on where someone is, that's not really up for our state legislators to decide. That's work that's being done at the national level. The FCC, Congress, they really have to get together and figure out what they want to do with regards to that. Now, there will also be text enabled on the 988 phone number. So in addition to answering telephone calls, my center also provides both text and online chat crisis counseling for folks. So right now we are doing that at a national level. So we do that for folks across the nation because that's the way the technology works right now. But in April, we expect that we'll start taking Kansas only chats for that. So when folks from Kansas are texting 988, they will be talking to someone who has been trained and supported by KSPHQ. You may hear, kind of depending on which circles you run in, if you're in really exciting crisis network professional circles like I am, you may hear a lot of exciting models about 988 co-locating with 911 PSAPs. Right now, we actually have over 118 911 PSAPs that serve the residents of Kansas. And so at least in these initial phases of 988, we're not talking about co-location with 911 centers. However, we are working very closely with the 911 Coordinating Council about providing training, cross-training back and forth between 988 and 911 call takers, and also working on developing plans and criteria that would allow our 911 call takers to transfer calls that could be better suited to immediate crisis mental health intervention rather than, say, law enforcement intervention to 988 centers. So that's something that we're currently working on. We have some good models in other places in the nation where they've worked out how to do this successfully and the best part of the world we're living in right now. So right now we have 3 centers that will be operating to provide 988 services, with a plan to add a 4th center that can be one more layer of backup service should all counselors be busy when a call comes in. Um, so why crisis lines, right? I think that this is again one of those education points that maybe I take for granted, but as I have engaged in talking with some legislators and providing testimony, oh, Layla, it'll be Health Source Integrated Solutions, or HIS, out of Topeka. So I think that there can be some usefulness in thinking about, like, why do I think that crisis lines are an intervention that we should have, right? Like, wouldn't it be better to just have everybody getting services face to face? And I am all about face-to-face services, right? That is something that I very much am a proponent of. But I do know that crisis lines are very often the first contact that folks will have with the mental health system in Kansas, and that it is an effective tool. That we have research that shows that folks who are engaged with an NSPL call center report being less suicidal and more safe after having spoken with a crisis counselor. I also know that folks who are experiencing quite severe crisis contact us, right? That we do know that a high percentage of callers who contact the NSPL centers have identified a plan for suicide or have taken some action for suicide. That we are talking with folks who are in a critical time of need, which is why phone, text, and chat is a very powerful tool. You are getting immediate consultation. You are getting services that are delivered in the kind of least restrictive setting, right? I mean, my guess is that I am not the only one on this call who has engaged with folks whose loved ones or they themselves have spent sometimes days in emergency departments trying to get the crisis mental health services that they need. And oftentimes what we're able to do on the crisis line is to identify a safety plan that will work for the short term so that we can avoid that kind of boarding in emergency departments. We also know that crisis lines mean that you don't have to be an expert on the system to get help for yourself or someone you love. I mean, how many of us have had a conversation with someone where at some point, as they're talking about a struggle that their loved one or they themselves have had, is saying, I just don't know where to get help. I needed help. I couldn't find it. I needed help. I couldn't figure it out. There was no one there. There was nothing that I could do. Well, a properly funded hotline, a properly resourced hotline demystifies that process, right? It no longer is dependent on you being a good advocate or expert to have success in navigating your crisis. And so, I think that having those services delivered to the person where they are increases safety for everybody. We can, I think, go ahead and So as I said, we think that 988 is a really important part of what I would call a comprehensive crisis continuum. So we know that a person in crisis can access the crisis line. And we know that about for between 80 and 90% of the calls that come into to the hotline, we can resolve that crisis right there. We can de-escalate things. We can help folks feel safe. We can give them the referrals that they need to be done with their crisis intervention at that point. In our ideal world, for those 20 to 10% of folks whose crisis wasn't resolved, we would be able to dispatch a mobile crisis team. So this is a mobile response that is an alternative to law enforcement, right? Some models would include a law enforcement officer, some folks would not. We know a large number of the folks who are contacted by a mobile crisis team can have their crisis resolved there in the community. And then in that comprehensive continuum, there would also be a crisis facility, for example, like the one in Wichita or in Kansas City, Kansas, the one being built in Lawrence. There's one in Topeka. I believe there's also one in Salina, where there would be a crisis receiving facility where folks could have a short-term stay to de-escalate from that crisis. And so as I'm going to talk to you about this legislation that we're working on this session, I would like you to keep in mind this visual of the crisis continuum and really thinking about how it's important to have each step along the way to give folks the best opportunity for resolving their mental health crisis before it results in them being at a hospital or worse, in jail. Yeah. We also know that 988 crisis hotlines can serve as a hub, right? A hub for connection to a lot of different kinds of resources. So yes, some of those crisis supports that we just talked about, but also helping folks think through what kinds of natural supports they have access to. Who in your life can be a support right now to get us through the short term? What kinds of community-based resources could be helpful here? What are our outpatient mental health services? So as I said, why crisis lines? Well, one of the reasons why crisis lines are important is that people want them. We did a brief review of the data at Johnson County Mental Health Center, ComCare, and KSPHQ, and we have all seen a significant increase in the number of calls to our centers starting in about 2016. So you see that Johnson County had an increase of 64%. We saw an increase to the NSPL at large of 59% from 2016 to 2020. We know that as folks become aware of these crisis lines, that it is a resource that people will use. It is a resource that can save lives. We on the next slide here, I think, we have some information about kind of what some of the result of that is. I said that we can resolve the vast majority of our calls on the phone. You'll see that Johnson County Mental Health Center activated 911 dispatch for 9% of their suicide related calls. KSP HQ activated that for 3% of the folks who called in a suicide crisis. ComCare doesn't gather information in quite the same way that we do, so we weren't able to get that figure for them. But I think what is clear to me is that when you are connecting someone with a trained crisis counselor, with someone with a mental health background, we can really interrupt the need for law enforcement to respond to suicide crisis calls. And every law enforcement officer that I have talked to is on board for that, right? They want to be available to respond to the calls that we need them to respond to. And we want to make sure that folks who are in a suicide crisis are talking with someone who can provide them with the kind of support that they're trained to give. So as you're probably starting to gather, this is a big job getting ready for 988. There are a lot of moving pieces. And so, representatives from all three crisis call centers, myself, ComCare, Johnson County, have been working with KDADs to draft a plan, an implementation plan. We also have monthly meetings of a 988 coalition with representatives from a broad cross-section of sectors, including suicide prevention coalitions, community mental health centers, 911 coordinating council, 211 providers, folks with lived experience, and then also an emphasis on folks who are in our rural and frontier serving agencies to think about how 988 looks similar or different in those areas of the state. So what have we learned through this planning process? Well, we learned that we need some things. We need some things to build a stronger 988 response. Georgina, the 211 providers are primarily the United Ways out of Wichita and then the Kansas City area. Please don't ask me to remember their names because they do have names and I can't remember them off the top of my head. And so, but they are the folks who are responsible for maintaining that 911 database or that 211 database. And so, you know, there has been an emphasis on thinking about how we formalize those relationships so that callers to 988 are able to receive good referrals. But as I was saying, like, what did we learn in this planning process? Well, we learned that partnerships are important, right? We learned that we need 211 at the table, that we need 911 at the table. But we also learned that we need some resources. If we're going to be taking all of the calls that come in now currently to the NSPL and prepared for this increase in call volume, we need staff. Like I need people in the chair at the phone to answer the call when it comes in, right? We've had this experience of vastly increasing crisis calls. And for many of those years, our answer rate was not able to keep up with the demand that we had here in Kansas because there just were not dedicated financial resources to that. And so as we have seen the state dedicate more resources to the crisis call centers, we've seen our answer rate increase. You know, we were sitting around 65% of NSPL calls in Kansas answered in Kansas, really up until 2020, until those last 3 months of 2021, where we got up to over 80%. So we're really looking at needing an investment in staff. In addition, we really do need to take a look at how we can leverage technology to ensure that good communication with 911 coordination, with 211 referrals, thinking about how we upgrade call systems to make sure that we have automatic call distribution phone systems. That's not something that you all care about, but just believe me when I say that what that does is that enhances our ability to answer more calls and make sure that they're routed to available folks. You know, and we know that we're going to have some kind of infrastructure need. One of the biggest ones that I really think about is how are we going to educate the public about 988? This is different than 911. This is different than really how we've done business in the United States for kind of our entire history. That's good. That's good feedback, Callie. I'm clearly distractible. But one of the things that I really think about is how do we help folks know what 988 is, why they should call it, how we can help, and help to really get a solid foundation for our populace about what this resource is. And I think that we need marketing or public education, public service announcements, however you want to kind of think about that for yourself. I think that some folks kind of have a hard time conceptualizing marketing mental health services, but I do think that that's what it is. And Callie, I think that this is the kind of feedback that we need in the planning process to say, okay, if 211 sucks in Western Kansas, then what do we need to be doing instead? You know, because that's not acceptable. I think that we need a solution where we can ensure that we've got a good way to connect folks in all parts of our state to resources that are available and make sense. So yeah, no, that's okay. So here you're getting a little bit of a glimpse into how many staff we think that we will need. You know, at this point, we are looking at adding a total of 11 full-time equivalents to our crisis contacts at KSPHQ. Johnson County Mental Health Center is building a 988 team. ComCare of Sedgwick County is in the process of identifying the number of additional FTEs that they will need. But we do know that staffing is a huge need. We want to keep these calls in Kansas if at all possible. So that is 988. That is one huge thing that is happening in the suicide prevention realm for Kansas, but that's not the only thing. That is not the only thing that we have going on in Kansas right now. 2021 was a huge year for the growth in resources and support for suicide prevention in Kansas. And I think that 2022 has a potential to be the same. So 2021, a group of folks pulled together, some of whom are on this call, to form a steering committee to launch the Kansas Suicide Prevention Coalition. So our idea was that to support sustainable suicide prevention efforts in the state of Kansas, that we really needed a statewide coalition. We needed a statewide coalition that was a place to bring together partners from across sectors with the mission to champion suicide prevention for all Kansans through equitable access to partnerships, advocacy, resources, ideas, and data. We know that we need to be united to prevent suicide. A visual that I have here is how do we kind of all get around the same table instead of being secluded at our own tables, and really thinking about how to amplify the work that is going on in our local communities and at the state level. So we launched the Kansas Suicide Prevention Coalition in September of 2021. We're having monthly meetings, still meeting today. We have really put together what we're thinking of as like a public-private partnership. So this is not a coalition that belongs to a state agency, but we certainly have state agencies at the table. We have strong representation from the Kansas Department for Aging and Disability Services, the Kansas Department of Health and Environment, the Kansas Department of Education, the Kansas Department of Wildlife and Gaming. I was on a roll there and then I lost it. But we do, because we know that suicide prevention is work that really spans across sectors, across state agencies. So many folks are working in this space. And so we know it's important to have our state partners at the table. We also know that we need our community partners here. There are folks on this call from incredibly hardworking coalitions that are working every day in your local communities to address suicide prevention needs, to educate folks about resources that are out there, to prepare people who want to be helpful when their loved ones are at risk. Who are working to bring evidence-based practices to your healthcare providers and your school districts. And you need a space to be able to say, here's what we're doing and what's working. Here's what we need. Here's what's not working. Here's why the state had a bad idea. Here's why the state had a good idea. We need everybody to be able to come together and have those conversations. We know that we need to include folks who have lived experience with suicide, folks who have lost loved ones to suicide, folks who have experienced suicide thoughts and attempts, people who have tried to navigate the systems here in Kansas. And how do we all come together to really develop a shared language and vision for what suicide prevention can look like in the state of Kansas? Because I think that we all know that one suicide death is too many. And to get to a place where we are saving lives, we all have to work together. And this opportunity to communicate. So we are meeting monthly. We have several different membership categories. You can join as an individual, join as a licensed professional if you're someone who is working in the mental health space, who has a passion around suicide prevention. Join as an organization, either nonprofit or corporate. We have a number of coalitions who are members. For the 2022, we're asking for a $25 donation to a coalition to help with coalition costs in order to be a member. We meet monthly on the third Tuesday of the month, with our next meeting being February 15th from 3 to 5 p.m. If you're already a member, thank you. and I look forward to seeing you in February. If you're not already a member, please reach out to the coalition email address. KSPHQ has been serving as kind of the point of contact for logistics for membership, and will continue to serve in that role. We've not elected coalition leadership yet, so there's still time if you're wanting to get in on the ground floor and lend your expertise in coalition work to the Kansas State or Kansas Suicide Prevention Coalition. But please feel free to reach out to that coalition email, and it looks like Meg put it in the chat as well. So thank you for that. So we have really exciting things going on. So what does that mean for legislative advocacy? Like, why did I take 45 minutes of your time telling you in great detail about both 988 and the Kansas Suicide Prevention Coalition? Well, that's because I think there are direct ways to communicate with legislators in your areas about ways that they can support both of those initiatives. So the first one that I will talk about is HB 2281, House Bill 2281. This is the 988 bill, right? This is the act that establishes the 988 network, establishes some expectations for how KDADS maintains that network, and honestly, most importantly, creates a funding mechanism for all of those crisis components that we were just talking about. So the bill establishes a suicide prevention crisis line fund that's got a lockbox around it, right? Funds in that, or monies in that fund, can only be used for the purposes of providing 988 services, either at the phone center level or the personnel to respond to those calls outside of the call center. So, you may have heard about monies that were, say, swept out of the Kansas Department of Transportation for other uses. This money would not be able to do that. We will impose a 25-cent fee per phone line on all phone lines across Kansas and fund the fund in that way. And then those monies can only be used for those 988 purposes. This is a reduction in the fee that we asked for last session, but is a compromise that we've come to with some folks from the telecom industry and have had our state partners at the agency level at the table for that as well. So we anticipate that this would raise a little over $8 million to be put yearly to be put towards crisis call centers, and then those crisis mobile response teams and crisis receiving facilities. Monies would also be eligible to be used for that education, public education that we talked about. So we expect that the crisis call centers will need about $6 million in funding year over year spread across them to answer those calls. And so monies from the fund will be used for that. So this is, I think, going to be, I'm hoping, a hot topic for the legislature this year. I think it's never easy to pass a new fee or a new tax during an election year, but I also know that Kansas is out of time. 988 is happening whether we're ready or agree with it or not. And I think that it's imperative and life-saving to have someone on the other end of the phone to answer those phone calls when somebody calls. The other point of advocacy and education, I think, is around the governor's budget recommendations. So the governor included in her budget that she proposed to the legislature some money for suicide prevention initiatives that would be included in the KDADS budget. And we really want the legislator to keep that in their budget as they work through that to the omnibus process through the end of the year, because we know that money can be used to support the statewide coalition, to ensure that it's got the logistical support that it needs to be able to continue pulling together that table for a common vision and language. It includes money that can be used for a statewide suicide prevention awareness campaign. So, here thinking about giving some resources to making folks aware of warning signs and risk factors for suicide, as well as how to help someone who's at risk where help is available. And then also funding to support local efforts through grants. So, I mentioned that we've got some of our incredible suicide prevention coalition partners on this call, and I think that we all know that a lot of the work that we do takes money. And unfortunately, there has not been an easily identified pot of money that can be used at the state level to do that work. This budget recommendation would make that a reality. And so I think that it's important, particularly in this year where we do have a surplus in our budget, to communicate to your local legislators that this is important funding for the work that you do, that this is important funding for keeping safe and keeping whole the communities that they serve. We know that suicide does not discriminate. It does not care how old you are, what your race or ethnicity is, what your income level is. It doesn't care where you live in the state, that we are all affected by suicide in some way or another, and that services, resources, and prevention activities need to be happening across the state. And this is really an opportunity that we have a chance to do that in a robust way, in a way that I honestly can't remember being able to do maybe since like 2014, maybe the last time that I can remember the state having dedicated suicide prevention funds to fund local efforts. So I think that this is an opportunity to educate legislators about that. And you don't have to do that alone. I think that we do have some ideas about how you can engage in that work. One thing I want to plug is a suicide prevention advocacy day that is being organized by the Greater Kansas chapter of the American Foundation for Suicide Prevention, NAMI Kansas, and my organization are working together to plan an advocacy day at the Capitol on February 24th. This part, our plan is to be in person. Obviously, we'll be monitoring public health conditions as we get closer to that date. I've put the URL to register for that event in the chat. It is free to attend. Lunch is provided, and we'll have information and some support for you all to make appointments with your legislators to talk about some of the issues that we've talked about today. I encourage you to get involved in the Kansas Suicide Prevention Coalition. If this is work that is close to your heart, is close to your organization's heart, this is the group for you, right? This is where you will find your kindred spirits. NAMI and AFSP both have policy advocate training. The NAMI Kansas actually has some trainings that are coming up on January 29th that I believe are going to be live virtual sessions. The AFSP has some recorded training, and those are really good ways to kind of think about how to tell your story, right? I think that suicide is something that is really personal. Right. When I think about my identity as a loss survivor, when I think about my identity as someone who lives with anxiety and depression, those are all very personal experiences to me. And I think that what this training does is just to help you think about how you want to share that story with folks who make decisions. And if none of these kind of planned advocacy opportunities work for you, I invite you to contact your state legislators. You can find them at openstates.org. I think that typically your local chamber of commerce chambers of commerce, that's probably how I'm supposed to say it, do a nice job of giving legislative updates or opportunities to interact with state legislators. Perhaps you're a part of an organization that has an existing relationship with your legislator. If you're not, I encourage you to reach out. I think that we underestimate the interest that policymakers have in learning about the work that is being done at the local level. I got loud and irritating at Senator Moran's office with some of his staffers about what he knows about 988 in Kansas. And now I have a meeting with them tomorrow, right? So I do think that policymakers at a lot of levels want to know what's going on, but in particular, your state house reps and your state senators, I think they want to know the work that you're doing, what's important to you, what's going to make things successful. I think that they get contacted by constituents with really tough stories a lot of the time and are looking to learn about ways to help them. And so don't underestimate the power that you have for being that kind of support for your legislators. The more often you contact them, the better they know your face. and the more easily they can converse about the things that are important to you. So if you take nothing else away from this, please know that I'm a big proponent of introducing yourself and getting your work out there. You deserve to brag on yourself. If there's any questions that I can answer, I've put my email on the slide here. Meg Hasselman, you want to wave, Meg? You don't know Meg, she is one of our incredible folks at JSPHQ who would also be happy to interact with you around any of the topics that we talked about here today. Yeah, I do think that, Candace, just thank you for the work that you're doing supporting our youth. More and more, I think every day it is becoming apparent how difficult the world is for our youth and their mental health these days. I think for a lot of different reasons. And I think that it is that we are all better off when we identify that supporting them and doing suicide prevention, that everybody has a part to play in that. So thank you all. And we have 4 minutes. So if you have any questions or comments, it turns out I can talk about a lot of this stuff all day, and I will. So let me know what else I can do. Well, thank you all for coming and spending some time. I feel really privileged that this is work that I get to do every day, and that the KPC does things like inviting me to talk about something that I think is really important and I feel a lot of passion around. So thank you all for this opportunity for sure. Did Linda or Michelle, did they sign on?
Yes, Linda is here.
Yes, I'm here.
Linda, do you all want to say hi and introduce yourselves? I didn't leave you very much time because I talk a lot, and so I apologize.
Sure. I just stuck a piece of candy in my mouth. I'm Linda Buckhuster, and I am the new state suicide prevention coordinator. Been in the position for about 5 or 6 weeks. So I'm new to this. I have been working with suicide prevention for the last couple of years in different aspects, working with different grants. But I look forward to working with this great group of people. Everyone's doing a fantastic job. I'm learning lots and lots and lots, and I look forward to working with you all.
And hey, everybody, my name is Michelle McCormick. I'm the Director of Victim Services at the Kansas Attorney General's Office, and wear many, many hats. But right now our office has a position as a youth suicide prevention coordinator to focus in on that very important issue and to work with this coalition of folks. The position is currently vacant, and hopefully we're going to be posting for that soon. So just keep your eye out for that posting. And so in the meantime, I am learning so much from this incredible group of people who've been working on these issues, and just want to echo Monica, the kudos in the chat. This was so incredible and very helpful, and appreciate all the work that's being done. Thank you.
All right, folks, if there are no more questions for Monica, Michelle, or Linda.
Doc has a great question in the chat.
Oh, take it on.
Oh, knock. So I think that this is a difficult, these are difficult tea leaves to read. So I don't have a very straightforward answer for you. What I know is this, that I have talked to a number of policymakers who say that 988 is a priority for them this session, that they understand the urgency of acting because 988 is coming to Kansas ready or not, right? Like ready or not, here it comes. So I will tell you that our chair and co-chair of the House Health and Human Services Committee, so that's Representative Brenda Landwehr, and her vice chair, Representative Epley, are both very committed to getting this bill out of their committee and to the House floor as soon as possible this session. I do, as I said earlier, I think that there is some concern that it is going to be a difficult vote for Senate leadership to want to take up because it is an election year. I also don't think that it's impossible. I think that we've got some strong advocates who are going to be pushing and making the case for that. But I also think that that is why it is really important that your legislators hear from you, that this is something that you care about and that you're paying attention to. 988 is a complicated issue. It's kind of hard to understand. And so, you know, I think that we need a lot of education for folks, for them to know that this is important and different than the other things that they have done for mental health recently, like, for instance, the Certified Community Behavioral Health Centers, the CCBHC bill last year. So I think it is possible. I think it's going to be tough, is where I'm at, but I'm optimistic that we'll get to the Senate. Did that answer that question, Knock, or in enough of a way that I feel like I can?
Definitely. Thank you for your response.
Okay. All right. Well, I'm showing 11:01. Like, y'all can stay and hang out. I really like to talk about suicide prevention and policy, and so I'm available to do that for the next little while. But I also understand if you have other things that you need to get to on your day.